I'm Dr. Mark Sugar. Today I'm going to talk to you a little about chronic cough. One of the major complaints that people have who come to an allergist is chronic cough. These people have been to their primary care physicians, their internist, their pediatrician, and they get some temporary relief of their cough, but it is not sustained, and invariably the cough recurs and they're back with the same problem. We try to deal with this in a very systematic way. This problem can be frustrating and in times very disabling to the patient. We evaluate the three major causes of chronic cough. The first is upper respiratory infections, sinusitis, and allergies. These patients can be evaluated here in the office with allergy skin testing, sinus x-ray, and rhinoscopy, which is a scoping of the nose and sinus areas and the throat to delineate more fully the problems in the upper respiratory tract. Now, the second diagnosis that's associated with chronic cough is asthma. Now, you think of asthma as being a wheezy type problem, but in fact there's a whole group of people with asthma who have cough only. This is called cough variant asthma. Now, cough variant asthma is evaluated in the office with traditional spirometry, which is a pulmonary function flow test, as well as a new test that we have available called an ENO, or exhaled nitric oxide test, which measures chest inflammation. Both are very valuable. The third diagnosis associated with chronic cough is acid reflux. Acid reflux is a condition that you associate with heartburn, but can cause chronic cough, throat irritation in the cases of people who have high acid reflux. Now, this diagnosis is made by history of chronic cough, hoarseness, and throat irritation, as well as rhinoscopy can be used to evaluate the vocal cords and the area around the pharynx. We typically find that 2 or 3 of these above diagnoses is present in any one individual with chronic cough. If we treat the problems individually, the 2 or 3 problems, we find we get excellent results and the chronic cough will come under control. If you have any questions of us, please don't hesitate to call Allergy and Asthma Associates, Southern California, or our website is socalallergy.com. Thank you very much.